I've been watching the pandemic, as we all have, for a number of months now, and I knew vaccines were coming. We had the great fortune of being given the opportunity to set up a volunteer, community-based public health model to deliver vaccines in our community. I am a member of 9 Health Fair for the past 40 plus years, and our 9 Health Fair committee in this area was happy to help put this together. We have over 300 volunteers now, just marvelous outpouring from the community, and a lot of people were so happy to have something to do about the pandemic. We have a supply team, a line management team, a traffic team, a post-observation vaccination team, a lot of physicians, nurses, community members, other healthcare providers. The vaccine we're using is the Pfizer, which comes out of the ultra-cold freezer from Animas Surgical Hospital, and it's delivered to us.
49, yes, 49 vials, 6 doses per vial.
Give or take, depending on the equipment that we have.
The people who are drawing up the vaccine are physicians, nurses, and other experts who handle a lot of injectable medications. And they were hand-chosen to do the draw up. It requires very good vision, very good dexterity, and they need to be able to work in a quiet environment.
These are our pre-filled syringes that we work on. It's the 0.3 milliliters of the Pfizer dose.
Ted Hall is the lead on the vaccination floor. He's a recently retired ICU and flight nurse, but the person who actually gives the shot is either a nurse or a doctor. We can use a variety of other healthcare providers, but mostly we have physicians and nurses doing the injections on our floor today. The vehicle enters the main entrance of the fairgrounds. We are parking about 30 to 40 cars in a batch. And all of those people come in one at a time, of course, to the 15 tables to receive the vaccination. And the vaccine is the easy part, giving the vaccination. That takes 3 to 5 minutes. I think if we had adequate supply of vaccine, which is one of the challenges still, if we had adequate supply of vaccine, we could do over 1,000 vaccinations in a day at this site. And then they go back out to the car for post-vaccination observation. And outside the building, Durango Fire and Rescue Authority is providing us an ambulance each vaccination clinic and 2 or 3 paramedics. The people who have come to receive vaccinations are delighted. They are so relieved to get the vaccine. I'm overwhelmed by the outpouring of volunteers. Everyone is happy and enjoying being here and feeling like they have a purpose.
This is just a wonderful experience. These people coming in, it's like the light at the end of the tunnel. They're so thankful.
One woman actually cried with joy last week, and it's just so nice to see the darkness lifting and be part of.
It's really awesome to have this kind of community support and people really wanting to come out and do the right thing and help with this pandemic. Each one of those stations is staffed by volunteers in the community that want to be here every weekend to make sure that their friends and neighbors have access to this vaccine, because this is how we're going to move through this pandemic as a community.
It's my intention to vaccinate our community as quickly as we can so that we can safely get businesses open and get our kids back to school and, of course, protect the community.